In today's Health Alert, there are 2 new drugs now available for children with type 2 diabetes. The U.S. Food and Drug Administration gave the okay to these medications, which have traditionally been used by adults with the disease. Our chief health editor, Dr. Partha Nandi, is here with the latest on these new treatment options for kids. And Dr. Nandi, how are they?
Yeah, I love this. I love this news, right? I mean, the drugs themselves, Glenda, are new, but their approved use for children ages 10 and older provide a new class of medications for pediatric type 2 diabetes. Now, Jardiance and Synjardy have been used for years in adults with type 2 diabetes. Now, they'll join metformin, which was approved in 2000 as treatment options for kids. Since the disease and its symptoms progress more rapidly in kids than it does in adults, these 2 additional oral medications are really a big step forward in addressing a major health concern among young people in the U.S. During the clinical trials, Glenda, the active ingredient in both drugs was tested for both safety and efficacy in more than 150 patients between the ages of 10 and 17. After 26 weeks, here's what they found. Hemoglobin A1C, which is the biggest indicator, right, decreased in the kids who received the active ingredient compared to an increase amongst those who got a placebo. Of course, it's important to remember that drugs are just one part of an overall treatment plan for pediatric and adult type diabetes. Patients should also eat a healthy diet. You got to lose weight, get exercise in order to control their blood sugar.
So are these drugs suitable for type 1 diabetes? And Doc, remind us of the difference between type 1 and type 2.
And I'm sure a lot of viewers are asking that, right? The answer to your first question is no. Jardiance and Synjardy are not recommended as a treatment for type 1 diabetes or for those with severe kidney problems. Why? The meds increase the risk of complications in these patients. Secondly, here's the difference between the 2 forms of diabetes. Type 1 is less common. It results from an autoimmune reaction of sorts and usually appears in adolescents and young adults. People with this form of diabetes essentially don't produce insulin. Type 2 diabetes, on the other hand, occurs when the body really doesn't use insulin in a normal fashion. And this results in large part it results in high levels of glucose that you see in the body. It's related to many lifestyle factors such as inactivity and carrying excess weight, which we've seen an epidemic of. Now, studies show that the number of kids with type 2 diabetes is rapidly increasing. Not a good thing. Over the past 2 decades, Glenn and Brian, the prevalence of the disease has nearly doubled in kids and teens in the U.S. However, now that we have these additional 2 oral treatment options, hopefully we'll see a slowing down of pediatric type 2 diabetes. But I've got to emphasize, it's not just pushing more drugs. You got to do the right thing. You got to eat well and you've got to exercise. You got to get off that couch and stop looking at that darn phone.
Thank you.
You sit in your assets and you look at that phone, your diabetes ain't going to get better.
All right, that was a daddy comment.
That's right.
All right, okay, thank you, Doc. Appreciate that.
My pleasure.
Be sure to tune in this weekend to the Dr. Nandi Show. This week, he's talking with youth sports and sitting down with former NBA star Willie Burton to talk about how sports and fitness has helped him physically, mentally, and emotionally in his life. That's Sunday, June 25th, 6 p.m., right here on 7.